In this chapter, we will discuss the orthosis described as an anti-spasticity or anti-deformity orthosis. This is an orthosis that positions the wrist, fingers, and thumb in an anti-deformity position. The main purpose of this orthosis is to keep the length of the soft tissue structures and muscles and to prevent the development of joint contractures, especially wrist flexion and/or first web space shortening. We will discuss and identify the key anatomical landmarks of the upper extremity for pattern making of this orthosis and perform the steps of fabrication. It is important to understand that there is no evidence that any orthosis prevents spasticity or works against spasticity. The orthosis functions to preserve the length of the soft tissue structures that may shorten over time due to increased muscle tone. Other interventions may be equally as important to preserve length of soft tissue and muscles, such as passive range of motion exercises and medications. Dorsally based material is molded around the forearm, while a volar piece of material maintains the fingers and thumb. The entire orthosis slips on the fingers and acts as a lever to lift up the wrist and hand. The specific positioning of the upper extremity in this orthosis is in an anti-deformity position. Each specific joint position will depend on the individual's contracture and diagnosis. The most common goal of positioning is to eliminate wrist and finger flexion. If possible, place the wrist in extension of 20 to 30 degrees. But for every individual, it is critical to understand their specific diagnosis and the best position for their specific case.